Good morning and good evening, everyone, depending on where you are situated. We have with us Dr. Sushant Kumar Goswami, and he will be talking about high blood pressures. And welcome you, Dr. Sushant Goswami from Sarala Academy. And please introduce yourself for 1 to 2 minutes, then start general about high blood pressure. Then we'll start asking you question to know more about this disease. Thank you.
Yeah, thank you for inviting me to give a talk on high blood pressure, which is known as hypertension. I am a medicine specialist and super specialization on kidney disease and nephrology, and again subspecialization also in transplant medicine, including kidney transplantation, liver transplantations, pancreas transplantation, and how to continue transplant rest of your life. One of our topic in kidney disease is hypertension and how to control it. Hypertension is defined by many in different ways. But as for the latest guideline, high blood pressure is 140/90 and above. If you are more than 60 years of age, then 150/90 is called hypertension and need to treat it. If you are less than 60 years of age, your goal is to keep the blood pressure below 140/90 or less. If it is more than that, then you need to treat it. This is the main hypertension guideline by JNC8, Joint National Commission 8, established in 2014. But the American Society of Cardiology and American College of Cardiology, they are very strict on their definition of blood pressure. They want everybody should be 120/80 or less. Up to 130/90 is okay, but it should not be more than that. But a lot of research has been done to find out what is the actual blood pressure should be treated. For general public, please remember, if blood pressure is 140/90, you need to treat. And if it's more than 60 years of age, blood pressure 150/90, you need to. That is the general consensus. Then we have subgroups of people who are diabetic, who have kidney disease, who have heart failure. They have a different goals of blood pressure treatment and different medications for blood pressure treatment. Pregnant women with high blood pressure, how to treat them? They need different kinds of medications, not the usual medicine we give for other people. So we'll discuss about subsets of blood pressure. And there are 10 different kinds of blood pressure definition. One is normal blood pressure 120/80. Another is elevated blood pressure, which is 130/90. Then comes the definition of high blood pressure, stage 1 and stage 2. Stage 2 is 140/90. That's when you need to treat. There is another definition called isolated systolic hypertension. That means the systolic blood pressure is more than 130, but the diastolic is less than 80. That is called isolated systolic hypertension. Another called is resistant hypertension. What is that? Resistant hypertension definition means the patient is already on 3 different medications. One of them should be hydrochlorothiazide, and the blood pressure is still not controlled. Blood pressure is still higher than 140/90. Then what you need to do? What are the 4th and 5th medication to start with? And who are those people who get resistant hypertension? Their blood pressure cannot be controlled. One of them is advanced age. The more you age, 70, 80, 90, the blood pressure will go up more and more. Another is obesity. You are big, chubby, obese, you need 2, 3 medications to control your blood pressure. That's why everybody should be exercising, lose weight, become lean and thin, become athletic, and then blood pressure automatically will drop. Another people who have resistant hypertension is renal artery stenosis. Kidney have artery supply on both sides. If one of the arteries is kinged or blocked or stenosed, then the blood pressure goes higher and higher. And those are the people very difficult to treat blood pressure. They need at least three different medications. Number 4 is chronic kidney disease. People who have kidney failure, they are not yet on dialysis, but they need more medications to control their blood pressure. Once they're dialysis, I have seen people on 5 different medications being on dialysis, their blood pressure not controlled. So kidney is very vital for blood pressure control. You need to know that. Then there are some disease of endocrine disorder, like hyperaldosteronism, Cushing's syndrome with a higher cortisol level. They also are very resistant for high blood pressure management, and they need multiple medications. And there is another type of hypertension called white coat hypertension. That means white coat means doctor. At home, the blood pressure is normal, but when you go to doctor's office with white coat there, your blood pressure goes up. Maybe due to stress, maybe due to panic attack. But then they come back home, blood pressure become normal. Another blood pressure, that's why when you do blood pressure measurement, you need at least 2 or 3 different measurements in different times of the day. One blood pressure measurement is not sufficient enough to stamp you as a hypertensive patient, because blood pressure vary diurnal variation. In the morning, you are calm down, blood pressure down. In the afternoon, you're working, stressed out, driving, running, blood pressure is high. And nighttime you sleep, blood pressure should be down. People who exercise, you should not do blood pressure measurement during exercise or after exercise. You need at least 10 minutes rest before you take your blood pressure, completely relaxed before take blood pressure. So these are the different kinds of blood pressure. Another one is hypertensive emergency. A lot of people live with little high blood pressure, it doesn't bother them. They don't have any symptoms. But there is a condition called hypertensive emergency. If your blood pressure is more than 180/120, that means you are going to be in trouble. Either you will have a stroke or heart attack, or it is more prone for causing effect on you and will damage a couple of organs inside you that you won't even know until you have a stroke or heart attack or heart failure. So that is called a hypertensive emergency, and the blood pressure is more than 180/120, and you need to treat the patient right away. Last one is called malignant hypertension. When blood pressure is more than 240/120, then you will have a bleeding inside your eye. Your eyeball will swell inside that you can see by ophthalmoscopic examination. Then you'll have a headache. You will have more chance of getting stroke. Those needs to be admitted to hospital and be treated with IV medication and drip control blood pressure, and then stay 1-2 days and then go back home. So these are the blood pressure definitions and types. Now we will go for the questions so I can answer you guys.
Yes, thank you very much. So for our audience, please explain what is that when you are talking about 120/80, That's a systolic and diastolic blood pressure. Please explain 1 minute about that.
Okay. There are blood pressure consists of two different things. One is systolic, one is diastolic. Upper level is 120, lower level of 80. These are normal blood pressures. When your blood pressure goes to 130 over 90, it is called elevated blood pressure, not hypertension. It's called elevated blood pressure. That means you can live with it. You don't need to take medication. But you should be aware that if you don't change your lifestyle, change your exercise pattern or eating habits or drinking habits, then your blood pressure can go up to higher level. Then you need to take medications. So what are the lifestyle modifications for blood pressure? If somebody has a blood pressure high, nobody jumps in to take medications. Nobody likes to take medications. The first thing to do is lifestyle modifications. Number one is exercise. You need to exercise at least 30 minutes a day for 5 days in a week and should have sweating. If you do exercise, no sweating, it is not an exercise. It's just like walking and talking and having fun. You need to exercise 30 minutes enough to have sweating. That's called exercise. 5 days in a week is enough. You can give weekend rest. Number two is diet. The diet for blood pressure is known as DASH diet, DASH. What is DASH diet? DASH is known as dietary approach to stop hypertension, otherwise known as DASH, dietary approach to stop hypertension. What kind of diet are they? They are low sodium diet, like up to 2.5 gram of sodium is allowed for normal people. If you take more than 3 gram, 4 gram of sodium a day, that means you are going to have high blood pressure. Number two is smoking. Smoking is independent risk factor for high blood pressure. When you smoke, you have nicotine coming out of the smoking or cigarettes. They cause spasm of the blood vessel and the blood pressure will go up. You need to relax the blood vessels, not spasm the blood vessels. So the more nicotine, the more smoking you do, it causes spasm of the blood vessels and the blood pressure will go up. You need to stop that. Then alcohol drinking. Now they advise for a little bit alcohol every day or alternate day is good for blood pressure. Little bit, like maybe 15 cc or 20 cc, not like a bottle of beer, not like a glass of wine every day. These are high level and that causes high blood pressure. So you need to stop that. Number four is stress. If nowadays everybody under stress, they're running like a rat race. They want to get up early, go to work, finish it late, so they don't get fired. A lot of stress going on. Even going to work, you live in Bombay or Delhi or Bangalore, you drive 2 hours to go to work, another 2 hours to come back from work. A lot of stress going on, and that causes high blood pressure. And then good night sleep. You need to have at least 7 hours of sleep per night and healthy sleep, not like getting up every 1 hour with stress and having jerky movements and having thoughts, nightmares. What will happen? You need a sound sleep, 7 hours. That will reduce your blood pressure, will keep your blood pressure under control. Sleep early, Early to bed, early to rise makes men healthy and wise. So sleep early, get up early morning. That's a good lifestyle habits. Don't sleep late like movie stars. They have a lot of heart attacks, bypass. And number four is um, risk factors is low socio-economic status. If you are poor, food, no house to live, no food to eat, you are stressed out. Every time you have stress, there are a lot of adrenaline, steroids, hormones are released on your body, and that causes high blood pressure. So those are important things to look for. Then another risk factor is called reduced nephron mass. What is a nephron? In kidney, the smallest unit in a kidney is called nephron. Like the smallest unit of a substance is called a molecule. Same thing, the smallest unit in a kidney is called nephron. Each kidney, we have two kidneys. Each kidney has 1 million nephrons. A lot of people are born with low nephron, like if they are premature baby, if they are low birth weight baby, if they are underweight baby, they have their body is less, their organs are less in size, and their kidneys are smaller, and they have born with very low nephron, not 1 million, maybe half a million. In that case, what happens when you have a low nephron? The remaining of the nephron wanted to be hyperactive. Half a million nephron will try to achieve the work of a 1 million nephron by overacting, by become hypertrophic, become bigger and bigger. The more they hypertrophy, the more chance of blood pressure sets in. So these are called non-nephron mass with high blood pressure risk for low birth weight babies, underweight babies, malnutrition babies, premature delivery babies. And other risk factors are age. The more you age, is more risk for high blood pressure. Number two is sex. Male have more chance of high blood pressure than the female because their constitution, their body mass, their adrenal or steroid hormone secretions is higher than them. So males are more prone for high blood pressure than the female. Number three is race and ethnicity. The blacks, the Africans, are highest risk factor for blood pressure. Why? Because they retain salt. Their kidney excrete less salt in the urine, so they retain more salt. And more salt means more water retention, and their blood pressure become high. So the blacks are the highest risk factor for blood pressure. Then comes Hispanics. All the Hispanics people, they're obese, tall, they are next in number. Third one is Asian, like Chinese, Korean, Indians, Pakistanis, most of the Asian are the third highest risk factors. The fourth highest risk factor is Caucasians, like white people. They have a less risk factors for hypertension than other people. Like lupus. Lupus, more colored people, non-white people have more lupus. Like this. So there is a racial difference between the hypertension, for the hypertension between the races. Then another thing, usually people don't know about it, is called syndrome X. Usually regular people don't know about it, but I would like to emphasize that people should know it. What is called syndrome X? Syndrome X is basically a metabolic syndrome. How metabolically you are inactive? The more metabolically you are inactive, you gain weight and become obese, and you have cholesterol deposits, and then you get more blood pressure. So, what are the definition of metabolic syndrome or syndrome X? Number one, it is the NCEP guideline, National Cholesterol Education Program guideline of metabolic syndrome or syndrome X, invented in 2001. It's called fasting blood sugar more than 100. Now, the definition of diabetes is fasting blood sugar between 60 to 90 is normal. More than 90 is diabetic. But metabolic syndrome is not a diabetic. It's telling if your fasting blood sugar is more than 100, or you are diabetic taking medications. This is number one criteria. Number two, your HDL level. When somebody exercises, the HDL level goes up. There's a part of cholesterol, the level goes up, that's good. One is bad cholesterol, one is good cholesterol. The good cholesterol is HDL. It is good because it works as a magnet, take out the bad cholesterol and digest in the liver. So if your HDL level is high, that means good. If you do exercise, your HDL level goes up. If you smoke, your HDL level goes down. So that's very important for metabolic syndrome to know what is your HDL level. If your HDL level is less than 40 for male, less than 50 for female, they are bad. They are under diagnosis criteria for metabolic syndrome. Number three is triglyceride. Normal triglyceride is 150 or less. If your triglyceride is more than 150, that means you are prone for metabolic syndrome. What is triglyceride? Triglyceride is directly related to the kind of food you eat. If you eat today, you eat a big pizza and lasagna and French fries, deep fries. Tomorrow morning, you check your triglyceride, it will be 200 and 250. Normal is 150 and less. But next day, you eat normal rice, curry, and everything, your triglyceride level normal. So triglyceride level, unlike cholesterol, it is related directly to the kind of fatty food you eat or oily food you eat. So you try to eat less fat and less oily food and keep the triglyceride level less than 150. And number four is obesity criteria. If your BMI is more than 25 or your waist circumference is more than 100 in a male or more than 85 in a female, they are called obese and they are a part of metabolic syndrome. So these are the things you need to know what is metabolic syndrome or syndrome X. Number one, fasting blood sugar more than 100 or being a diabetic on medication. Number two, HDL levels if less than 40 in a male and less than 50 in a female. If triglyceride level more than 150 and the waist circumference in a male more than 100, in a female more than 88 is called metabolic syndrome, and they are very prone for high blood pressure. You need to be aware of that. So these are the
We
risk
want,
factors, lifestyle modifications, and types of hypertension. Anything else you want to know?
yes, we want to know what are the symptoms, how people know that they might be having high blood pressure.
Okay, symptoms of hypertension. First of all, let me tell you, 90% of the patients are asymptomatic. They have no symptoms. Only 10% patients have symptoms. But if symptoms happens, why symptoms happens, you have to understand. When the blood pressure damage the organs, it's called end organ damage. That's how the symptoms develop. If you have blood pressure caused already stroke, that means you have confusion, you have delirium, you have memory loss. It's called vascular dementia. The more stroke-like symptoms you have, more dementia you have. Loss of memory, confusion. That is one thing. Number two is headache. Headache is usually people complain of headache mostly on the back of the head. It's called occipital headache. The front of the head is sinusitis. Side of the head is vasculitis. Back of the head is hypertension related. Number three is dizziness. So you are sitting on a chair and eating, then you get up, you feel dizzy. It could be due to very low blood pressure or could be very high blood pressure. I had a patient who came day before yesterday. Doctor, I'm feeling dizzy now. He was sitting in our clinic and he's saying, I'm dizzy. I don't know what is happening to me. So we thought, okay, let's check the blood pressure. His blood pressure was 210 over 95. I told, that's why you are dizzy. You are not controlling your blood pressure. Do you have a blood pressure machine at home? No. Well, you need to buy a blood pressure machine and check blood pressure 3 times a day. 6 o'clock in the morning, 4 o'clock in the evening, and 10 o'clock at night before you go to bed. And make a list and bring to us in the next week. We'll see how blood pressure you are maintained. Okay, these are blood pressure symptoms if the brain is um, having problem. Another blood pressure symptom is heart. If you have a chest pain, you might have a heart attack, a mild heart attack from high blood pressure. You may have shortness of breath. High blood pressure can make heart to fail. If you have high blood pressure, then the heart has to work harder to push blood out of the heart against the high blood pressure. If a normal patient, the pressure on the heart is 5 pounds. If you have very high blood pressure, the pressure on the heart is 500 pounds. If heart has to pump against 500 pounds, it will fail. It will be tired. When the heart fails, it's called congestive heart failure. Then you will have a fluid retention on your lungs, your legs will swell. These are the symptoms of edema and body swelling and fluid retention from high blood pressure. If these are the brain and heart. Now, third thing is kidney. If your kidney is involved from high blood pressure, what are the symptoms you will have? You'll have a renal colic. You'll have a pain on the abdomen where the kidneys are. Then you'll have a blood in the urine. The high blood pressure will start breaking off the blood vessels in the kidney. Then you'll have a hematuria, blood in the urine, protein on the urine. Then gradually your kidney function will go down. You check your kidney functions, your BMP, your chemistry, your blood work will show high kidney functions is getting down and down. That's how you know your symptoms of high blood pressure. Sometimes shortness of breath. You can't breathe. You walk 2 miles or go 20 steps upstairs. You can't climb 3-story building. That means they are having probably blood pressure is affecting your heart and causing heart to fail. And once you control blood pressure, within a month, your heart is out of stress and you can walk 3 stories building. You can run 1 mile. So these are the symptoms dependent on the organs involved due to hypertension.
Okay, good. Thank you. So we have approximately around 8 minutes remaining. So within that, we can take 2-3 questions. So what is the number one medicine that doctors prefer? I think there will be different medicine based on different disease criteria, age criteria, as you told. And I want to know what is the adverse effect that may happen if people are just taking medicine, not going to doctor. Like, because for instance, if they take maybe some medicine and there is loss in the electrolyte, and it may cause spasm or it may cause some kind of epilepsy. So we want to know that kind of information.
Okay. Okay. Let's tell you in short about the important medication for blood pressure and their side effect. Okay. Number one blood pressure medication for hypertension is hydrochlorothiazide. It's a diuretics. If you don't control your blood pressure with that after a week of hydrochlorothiazide, then you add another medicine called AC inhibitor, like a lisinopril, mm, mm, other medication. There are like 5 different medications called AC inhibitor. Number three, if you don't control with that, you can add another medicine called calcium channel blocker, amlodipine, cardigem, verapamil. If you don't control blood pressure with that, then another group medication called arterial dilator, like hydrolazine, methyl dopa, minoxidil, prazosin. Then, if you don't control blood pressure with that, then fifth medication could be aldosterone antagonist like spironolactone, aldactone. Those are the things. Now, the side effect of each medication. Let me do. When you do blood pressure, every week or every 2 weeks initially, then monthly thereafter, you should do blood check. Number one to check is your sodium level. If you're taking hydrochlorothiazide, your sodium level will go down. So you need to replace sodium for side effect of diuretics that you are taking for high blood pressure. Number two is potassium level. If you take AC inhibitor like lisinopril, fosinopril, mm, or benzapril, quinapril, ramipril, trandalopril, candesartan, valsartan, losartan, olmesartan, telmisartan. Those medications, they increase the potassium level. So you need to check your potassium level. If potassium level high, you reduce the medication dose or stop it. Give another kind of medications or take less potassium diet. There are a lot of diets which are rich in potassium. You need to stop that, like tomato, um, strawberries, different kind of berries, bananas. They're high in potassium. But in general, high potassium diet is good for blood pressure because the more potassium you take, it will excrete more sodium on the urine. And that's how you check your blood pressure will be better. But if your medications have high potassium level because of the side effect, then you need to cut down the potassium and need to reduce the dose of those medications that I told called AC inhibitor or ARB, angiotensin receptor blockers. The number three, you need to check hypoglycemia. A lot of people have diabetes. When the blood sugar goes down, they become tachycardic, they're sweaty, they're kind of stressed out. Either blood pressure has gone up or the sugar has come down, called hypoglycemia. If you take beta blockers like metoprolol, bisoprolol, carvedilol, acebutolol, betaxolol, these are the called beta blockers. Their side effect is hypoglycemia awareness will be less. That means you have hypoglycemia, but you will not have symptoms because you are taking in the beta blockers. So these are the bad things, because if you don't have a hypoglycemia symptoms, you may blood sugar may be 20 and you die. So in those kind of patients who are diabetic, those who have high cholesterol, those people don't give beta blockers, because that will abolish the hypoglycemic awareness. Then you will not know that you are getting hypoglycemia, and sugar will drop and will drop dead without knowing the symptoms. So beta blockers will mask those symptoms. So people with diabetics, we don't advise beta blockers. Heart failure also, we don't advise beta blockers. Then called proteinuria. A lot of people who, they're good medicine for proteinuria, like you are losing urine on the protein because of blood pressure. Side effect, like amlodipine, can cause proteinuria. But if you have proteinuria, the best, and high blood pressure, the best medicine for that is to give AC inhibitors. Then another side effect is tachycardia. If you are taking hydralazine, which is an alpha blocker, or minoxidil, or prazosin, they're alpha blockers. That means they will alpha. What does alpha do? Alpha receptors do to the blood vessels. They they cause spasm, and the blood pressure go up. So alpha blocker will relax these blood vessels, and the blood pressure will go down. So those are the medication called hydralazine, minoxidil, and prazosin. Because they decrease the blood pressure, they cause reflex tachycardia. So because to the blood, some blood pressure medication, when they decrease the blood pressure, they cause tachycardia. Pulse rate will go up. Your heart rate will go up. You'll start sweating. They are the side effects called reflex tachycardia. These are the possible side effects of somebody taking hydralazine, minoxidil, prazosin. So we need to decrease the dose or stop.
Okay, thank you.
Reflex tachycardia.
I think
Mhm.
we are coming towards the end of our recording. Thank you for the information that you gave, and we'll follow up with more questions on different topics. Thank you so much.
Thank you. Thank you.